Well, for more on World Malaria Day and a closer look at the fight against malaria, I'm joined by Kathryn Jacobsen. She's a global health expert with a specialty in population shifts and disease. She's also a faculty member at George Mason University. Thanks so much for being here, Kathryn. So tell us about this Malaria Day compared to, let's say, last year's. Has there been a lot of progress?
Well, if we look at the past 15 years, there's been huge progress in malaria control. Back in 2000, when the Millennium Development Goals were established, we had a goal of halving malaria deaths by half by 2015, and we've achieved that. So it's 2015, and it is time to step back and celebrate a major global public health success. At the same time, we still have more than 500,000 people dying of malaria every year, and most of those deaths are children in Africa. So 500,000 deaths that are still preventable. So we don't want to just celebrate the success, we want to learn from that and continue to push toward malaria elimination.
How have you been able to achieve such success, or have health experts been able to achieve this in eliminating the disease?
Yeah, one of the big pushes has been for the use of insecticide-treated bed nets. So the idea is that mosquitoes often bite at night, especially while children are sleeping. And if they're underneath a bed net, there's a physical barrier between the mosquitoes and them. But the key part there is that it's insecticide-treated. So if a mosquito lands on that net, it will die. And so the nets being in the house keep the house from being filled with malaria-carrying mosquitoes. So the bed net use rate has increased dramatically in the past 15 years. And we attribute a lot of the success in the reduced deaths to that changed behavior. While we do hope that we'll have a malaria vaccine soon that's widely available, that's not the case right now. Right now, we can't rely on a vaccine, so we have to work on mosquito control.
So you talked about the insecticidal nets. What else? Indoor residential spraying or applying creams and sprays when you go out? We have a huge audience in Africa, so educate us.
Right, so one of the things that a lot of people living in Africa would say is our children get malaria so often, and it seems like it's just a regular part of childhood. And one of the things we hope as we move forward in the next 10 years is to change that reality.
Stigma, yes.
And to say that malaria is preventable. We can prevent it, we can treat it, but let's work on preventing it as well. Let's not make it a routine part of childhood. There are still about 200 million cases of malaria every year, and we can do better at getting that down. People who live in endemic areas know about bed nets and they know about using indoor residual spraying, but not everybody has access to those tools yet. So we want to push as an international community to continue to increase for the people who are most vulnerable to malaria to have access to the things they need to protect their children.
How do you get the insecticidal nets?
There have been lots of international support for this. So there are a lot of governmental agencies that are helping with that, a lot of non-governmental agencies as well. So different nonprofit organizations are adopting in some ways some parts of the world and making sure that nets get to people. There are also small businesses that are trying to help increase access and also increase economic development in areas affected by malaria.
All righty, Kathryn Jacobsen, thank you so much with George Mason University. We appreciate your time and your insight on this very important day and eradicating, hopefully, eventually for good, malaria. Thank you.